Kenya is now close to achieving epidemic control, having met the 95-95-95 global targets. 95% of people know their HIV status in Kenya. 102% of those diagnosed are receiving treatment, and 97% of those on treatment have achieved viral suppression. Despite a 65% reduction in AIDS-related deaths since 2013, the incidence rate remained at 0.39% per 1,000 people in 2023, with the majority of new infections occurring among those under 34 years. The HIV/AIDS epidemic continues to disproportionately affect vulnerable groups, including women, girls, adolescents, and key populations exacerbated by healthcare inequalities, stigma, and discrimination. This intersection of adversities highlight the urgency of scaling up multilateral interventions to address the compounded vulnerabilities faced by these groups. We are at a critical juncture where traditional strategies are insufficient to keep our goals of ending AIDS by 2030. While past approaches were rooted in healthcare, they often overlook broader drivers of infection, such as social and economic disparities, poverty, illiteracy, and environmental factors. Our theme calls for coordinated, inclusive, and multi-sectoral approaches to ensure universal access to prevention, treatment, and care. It also urges us to re-energize our efforts from strengthening global partnerships and securing sustainable financing to promoting equity and human rights, leveraging innovation, and building resilient health systems. Kenya has historically relied on bilateral and multilateral aid to fund its annual HIV/AIDS budget, which stands at Kenya shilling 24.5 billion. However, with declining external funding, it is imperative that we develop robust mechanisms to make our HIV response funding more predictable and more efficient. To this end, Kenya is implementing a financing transition roadmap that focuses on governance, stewardship, domestic resource mobilization, program efficiency, and sector-wide integration. This roadmap aims to align HIV strategies with national healthcare and economic plans while enhancing accountability. Additionally, Kenya has committed to implementing universal healthcare coverage, which includes a comprehensive overhaul of the national healthcare system. This program aims to protect citizens from health vulnerabilities during crisis by prioritizing equitable access to healthcare services and integrating HIV services into the broader health and social protection frameworks. I firmly believe that the many vulnerable lessons from our national HIV and AIDS response can guide us in renewing our partnerships and securing the political support essential for the success of multilateral institutions. This event offers us, all of us, a platform to recommit to partnership and collective action on a global scale, ensuring that HIV never again poses a threat to our people, communities, or our globe.
In the midst of all the noise and all the doubts, this partnership that I call a movement is the proof that multilateralism works and that the United Nations is the platform. Thank you. Today, we will celebrate our collective achievements and reaffirm our commitments to end this disease. You have shown that multilateralism is not just a theory, a concept. It is the way we have saved lives and kept the world secure. We celebrate nearly 31 million people who are already on treatment. And we commit to reaching the 9 million people not yet reached. We celebrate the 60% reduction in new infections, and we commit to drive down new infections much further, much faster, turning off that tap. We celebrate the progress we have made in advancing rights, and we commit to rights for all people without discrimination. Learning from our successes, the path ahead is clear. It's also the path to solving all other global challenges. Here are the things on the path. First, shared responsibility and global solidarity. No single country can ever solve global problems on its own. Second, ensuring that the benefits of scientific innovation are shared by all countries. We could be on the doorstep of an era of long-acting HIV medicines for prevention and for treatment if we act together. Third, today's pandemics are driven by inequalities. Reaching vulnerable, marginalized people first and putting human rights at the center is key, and ending stigma and discrimination. Fourth, people living with HIV and communities putting them in the lead. Nothing about us without us, making it a reality. Thank you very much, James. He's caught up in traffic, New York traffic. Today, multilateralism is under threat. The way to solve global challenges. Joint program on HIV/AIDS, the Global Fund for the AIDS response, and for every other pandemic. Stopping on the path to winning could mean
than we don't have. So today, when we discuss HIV in 2023, the AIDS response has been
with dramatic decreases in HIV infections and AIDS-related deaths, and thus setting us that template for where the world can follow from your example, your success, your outcomes. Now we move to a special video address from a former head of state who was at the very day. To introduce his video, I have the pleasure welcoming now Hannah Johnson from the George W.
Good afternoon. Thank you. Threat by 2030. Let's not abandon the incredible progress.